Hi, my name is Lauren Agee, and my 5-minute video topic is viral upper respiratory infections, or URI. Chances are, if you were able to listen and understand this video, you have had multiple of these infections in your lifetime. A viral upper respiratory infection is a very common, highly contagious infection of your upper airways, which includes your sinuses, nose, throat, pharynx, larynx, and bronchi. Though the common cold is the most common form of a viral URI, sinusitis, pharyngitis, epiglottitis, and tracheobronchitis can also fall under this category. Bacteria can also cause these same illnesses, but viral causes are most common. Though an upper respiratory infection can happen at any time, fall and winter are the most common seasons and account for many doctors' office visits. Symptoms of upper respiratory infection include coughing, sneezing, congestion, runny nose, fever, and sore throat. The symptoms of URI usually last between 3 to 14 days, where the first 3 to 5 days are the worst. Viral URIs are self-limiting. People who live in crowded or closed-in environments with many other people, such as hospitals, nursing homes, daycares, or schools, are at high risk for this diagnosis. When someone sick sneezes or coughs without covering their nose and mouth, droplets containing the virus are sprayed into the air, so people who are exposed to others in small spaces often develop this illness. It is estimated that school-aged children will have 6 to 8 colds a year while their immune systems are still developing. From September to March, people are more likely to have a URI since indoor heating and low humidity favors survival of most viruses. Another risk factor is having a weakened immune system, such as people on chemotherapy or living with HIV. There are many important questions to ask patients during a sick visit, but there are 3 I would focus on for the workup of a URI. First, how long have your symptoms been present? If symptoms are from 3 to 5 days, the cause is likely viral. If the symptoms have been persistent for longer than 5 days, the cause may be bacterial and may need antibiotic treatment. Second, have you had a fever? Viral infections typically cause fevers more than bacterial. This can help identify the source of the illness. Also, if the patient is experiencing high-grade persistent fevers, they may need to be monitored more closely and have more aggressive treatment. Finally, have you had shortness of breath or difficulty breathing? This can help clue you in on lung involvement to assess. If more lung symptoms are present, this would not be considered an upper respiratory infection, but could be a pneumonia, asthma flare-up, bronchitis, or lower respiratory infection. There are also 3 physical exam components I'd be sure to assess. First, I would do an otoscope exam to rule out otitis externa or media. For viral URI, I would hope to find a pearly gray TM with no bulging, retraction, or redness. Second, I'd visualize the throat and tonsils and possibly take a swab to rule out streptococcal pharyngitis. I would expect to find an erythematous throat with possible postnasal drip, but tonsils should not be abnormally edematous, red, or have exudate on them, and the uvula should be midline. Finally, I would auscultate the lung fields. I would listen to the throat to assess for stridor, which should not be present in URI. Then auscultate all the lung fields for adventitious sounds such as crackles and wheezing. I would also listen to the patient's cough, if they had one, to assess if it was dry, barking, or wet. Wheezes may be present in some URIs, especially if the patient has a history of asthma. If a lot of adventitious sounds or no sounds are heard, a chest x-ray may be warranted to rule out mass, pneumonia, or pulmonary embolism, for example. URIs are treated for relief of symptoms. Some people benefit from the use of cough suppressants, expectorants, vitamin C, nasal decongestants, and steam inhalation to reduce symptoms or shorten the duration. Analgesics like Tylenol and NSAIDs can help reduce fever, aches, and pains commonly caused by URIs. Since the URI is caused by a virus, antibiotics would not be effective for treatment and should not be prescribed. Teach your patient to drink lots of fluids to keep secretions thin so they can be easily expectorated and so they don't get dehydrated. Also, patients need to monitor their fever and treat with Tylenol and/or ibuprofen. Finally, the best protection against further URIs is frequent hand washing with soap and water. Washing your hands reduces exposure to secretions that can spread infection. You should also avoid being in close contact with people who are sick, cover your mouth and nose if you're the one who is sick, and stay at home to prevent further spread. I hope you learned something from my video and stay proactive because winter is coming.